In July of 2015, I was on a professional development trip. I'm a teacher, so I was doing some work and I was in Calgary, Canada. And unfortunately, I had an accident. I hit my head very hard above my right eye. And when that happened, I immediately felt dizzy and nauseous and just was very much off, not myself. And then when I got back to Illinois, I right away went to my primary care physician because I was still spinning with nausea and just not feeling right. And during this time, my doctors seemed to feel that the concussion would resolve within 4 to 6 weeks, and their response was generally the same: go home and get some rest. But as what continued to happen was I was spinning for literally about 2 months, where I had a vertigo sensation. I had difficulty concentrating. I was very, very overtired. My brain was in a brain fog. I was really frustrated with the medical response because I wasn't getting any better. And so I was doing a lot of research online. I was really desperate. And I went to my local library and I literally just put in the term concussion. And the first book that popped up was a book by a man named Dr. Clark Elliott. And Dr. Elliott wrote a book called The Ghost in My Brain, and it was all about him and the concussion that he sustained in a car accident. His description of his symptoms very much were the same symptoms I was experiencing and that I was trying to share with my doctors. The best part of the book was the fact that Dr. Elliott had met Dr. Zelinsky. And Dr. Zelinsky's a neuro-optometrist, and so he starts to describe what took place when he worked with Dr. Zelinsky and another doctor who were ultimately able to give him his life back. And so that book gave me a sense of hope that I'm going to get my life back if I can get the right help. And Dr. Zelinsky has been giving me amazing help.
When Cathy came to me, she was suffering from the same symptoms that many of the brain trauma patients have: light sensitivity, sound sensitivity, trouble with concentration, and trouble balancing. We had to do testing for general eye checkup, the eye health and the eye sight and the eye movement. But in addition to that, at the mind-eye connection, we emphasize what the eye is connected to. And so the testing we did went a little further than standard eye exams. For instance, in a standard eye examination, you look at eyesight on a target on the wall, and the target's not moving. But in real life, you're walking around with moving targets. So there's two parts of your eyes being used for that, the central part and the side part. So when we tested Cathy for the central part, we asked her, could she see the target? And then we asked her, did each eye make the target look the same size or the same depth? In a lot of patients after brain injury, they perceive differences in size and depth from each eye, and that's not checked on a regular eye exam. After we checked her eyesight and how each eye saw differently, then we tested eye movement. And on a standard eye test, you're checking for any paralysis of a muscle. So we moved a target and had her following it, and you could see how smoothly her eyes moved. So in a regular test, she'd be marked as perfect because she had no paralyzed eye muscles. But then I want to see what it's like when her conscious attention is on a different task as opposed to following the target. So I asked her to spell something backwards. When she tried to spell backwards and had to think about it, then her eye movement stopped. She lost the target. She had to catch it again. And those jerky eye movements are indicative of somebody who can't put their peripheral eyesight on autopilot. We have a depth perception test where you can see Cathy wearing polarized glasses, but there's two kinds of depth perception. There's one that's general scanning, where you're hunting to find something, and there's a different one that's a little more fine, where you're told, look at this small box in front of you and tell me which circle is popping up closer. So when we did the general testing, she was much slower than average. She was not able to scan the whole surface to find a target. She had to take her eyes and look at piece by piece by piece by piece till she found it. And then in the specific one, she was able to see them quite well. In addition to visual processing, there's auditory processing. if the visual and auditory processing is out of sync with each other, then you're going to have a problem interacting with the environment. And a lot of brain trauma patients have a disconnect between eye and ear processing. So in Cathy's case, we use a test that I patented in 2009 called the Z-Bell test. In Australia, they call it a Z-Bell test. And we rang a bell, and she closed her eyes and tried to find where the bell was. As you can see, she was able to do it on her right side very easily in either bright or dim light, but on her left side with a low pitch, she could not find it very easily in the brighter light. That was her weak spot. Once we found her weak spot, then we were able to work with colors and lenses and prisms to find which glasses allowed her to accurately locate the bell no matter what the lighting was. And then we could prescribe from there. Well, the other thing about the retina, which is fascinating, is it's like a patchwork quilt. It's not just one thing in your eye. It's got different sections. So if you angle the light upwards or downwards or sideways, you are sending signals through different parts of the brain. It's like routing things through different highways. And which highways in a person are disrupted after brain injury is easy to figure out when you have them try to walk while you're pulling the light different directions. So in Cathy's case, when we pushed the light toward her right, you could see her go, whoa, I can't tolerate this. And when we pushed it toward the left, she didn't have any problem. So that is seen in a lot of brain injury patients. Cathy started a rehabilitative program here, and we're using a series of glasses to slowly build up her comfort and tolerance ranges to changes in the environment, and she's doing quite well. She's hoping to eventually be able to go back to work, and we'll see what happens over the summer, because we'll be a little bit more aggressive and see if she can go back to school and teach in the fall.